on assessing knowledge, attitudes, and practices of dog owners towards care and providers in the long urban, and the research was being supervised by Dr. Vincent Allison. In the first place, care and providers is a highly contagious and infectious viral disease in dogs, and it is caused by a small single-stranded DNA virus called CBV2. The causative agent of acute hemorrhagic enteritis and myocarditis. The disease affects dogs of all ages, but the puppies are more susceptible due to their high rate of cell division in their intestinal lining. Transmission is through oral contact with infected feces or contaminated surfaces, and tentative diagnosis is based on the clinical signs such as vomiting, depression, diarrhea, especially bloody, anorexia, and fever. And definitive diagnosis includes the standard treatment of canine parvovirus is directed towards collecting the balance of electrolytes and fluid, and it involves hospitalization with IV fluid therapy. Additional therapies include antiemetics such as metoclopramide and antibiotics such as meronidazole. Prevention and control is through vaccination and proper. You can appreciate the transmission of canine parvovirus. There is high mortality and morbidity. The main objective was assessing knowledge, attitudes, and practices of dog owners toward canine parvovirus in the urban, and the specific objectives were to assess the level of knowledge among dog owners regarding canine parvovirus, to assess the attitudes of dog owners towards canine parvovirus, and to determine the practices of dog owners in relation to canine parvovirus and other diseases, and also to identify the fact that purposive sampling technique was used due to the lack of database information on the population of dog owners in the government. Data analysis and presentation. The data was collected and entered in SPSS version 23, analyzed using descriptive statistics such as frequencies, percentages, and charts. Constellations were used to determine how factors such as age and knowledge of dog owners are related, and chi-square tests were used to identify the associations between factors such as gender and age. The graph shows that out of the 40 participants interviewed, 17.5% reported having knowledge of canine parvovirus infection, and 82.5% do not have the knowledge. The pie chart shows the vaccine. The cross-tabulation of gender and knowledge of canine parvovirus among dog owners. So the p-value is above 0.05. This shows that there is no significant relationship between gender of the owners and knowledge of canine parvovirus infection. And also, the results shows that there is no significant results also shows revert that out of the 40 participants interviewed dog owners, 50% reported vaccinating their dogs on time, 20% irregularly, and 10% never vaccinate their dogs. Out of the 90% that vaccinate their dogs, 82.5 is only for rabies vaccine, virus infection, and its vaccination, especially ARV5 according to the results. And owners are well informed of rabies vaccination than canine parvovirus vaccination. I would recommend for campaigns on canine parvovirus infection in Lilongwe and promote canine parvovirus vaccination should be promoted alongside rabies vaccination. And also there should be lastly, I would like to Acknowledge Almighty God for the endless strength and guidance, my beloved mother for the tireless support and love, to the principal of Migolombe College of Veterinary Science, to my supervisors, Dr. Vincent Kandisi, and I would also like to acknowledge Dr. John Kotoa and LSPCA team for the support, to my friends, classmates, and all the directors. Thank you.